So welcome everyone. This is a program that's being, in a way, I guess, sponsored or promulgated by the COVID-19 Collaborative, which was an effort that was pulled together in late 2020 and has been working on a variety of efforts that moved from testing to public communications about access, to vaccination, to the community health worker program. And now that we have reached this stage, we are adapting again. And it is to the issue that is we're all grappling with, including us at the Community Foundation. I guess I should introduce myself. I'm Dan Baldwin, President and CEO of the Community Foundation for Monterey County. And on this transition back to a life that used to come so naturally to us up until March of 2020. But there are, we're all grappling with safety of our employees, adhering to law and best practices, and how we interact with the public. So that's the extent of my introduction. I'm so pleased to see such a great turnout. I'm going to turn it over to Kim Stemler, who is the project manager working on what was sort of vaccination efforts, and now she's just our Swiss Army knife here doing whatever it is. And very pleased to have her as part of this. And Kim, the floor is yours.
Thank you so much, Dan. And thanks for everyone for being here. And I'm totally changing my title to Swiss Army knife. I don't know if everybody knows about the COVID Collaborative, but it's really unique. And as we partner with people from throughout the state, there are not many other regions that have come together in this multidisciplinary group of private industry, public sector, CBOs, just doing whatever we can to make sure that Monterey County, and I know there are people from other counties on this as well, but doing as much as we can to keep our community safe and healthy. So thank you all for being part of that. Today, we are really privileged to have some guests. We knew that the CalOSHA changes were very confusing. So as soon as it looked like they were going to change, we asked our friends at CalOSHA if they would have someone speak to us, and they generously said yes, even though they're going a bit crazy, as you can imagine. And then TPO generously offered Melissa Irwin to also come and really share the practical aspects of keeping your workers safe. Interpretation is available during this. If you're interested in hearing this webinar in Spanish, our interpreter Avilia is available for you. You just go to the icon, the interpretation icon at the bottom, and switch it to Spanish, okay? And if you're working on your Spanish, that might also be an alternative. This is officially a webinar, so we can't see all of your faces, unfortunately. There are just a few too many of you right now, which is very good. We'll be receiving your questions and want your questions throughout chat. I mean, throughout the webinar. And what we'd like you to do is type it into chat. You can type it in English or in Spanish. If we can integrate it into the initial conversation, we will. If not, we have made a lot of time for Q&A at the end of this session, really at halfway through this session. So the way today will work is I'm almost done talking. I'm going to turn it over to Nick from CalOSHA. He is going to present the changes in CalOSHA, which again are very new for him as well. And then we'll turn it over to Melissa Irwin from TPO. So let me tell you just a little bit. I want to do the official bio thing. Nick Gleiter is the manager of CalOSHA's San Francisco Bay Consultation Service area offices. And he's been working with the state for over 20 years and has a great sense of humor. Before working with the state, he both worked for and earned his master's degree in occupational safety and health from USC. Nice school. And then Melissa Irwin is a nationally certified senior professional in human resources, working with our friends at TPO for over 20 years. Melissa specializes in training and has a generalist perspective of HR management and works with business owners and managers, offering a really broad spectrum of consulting services. Over the last year, Melissa has become an expert specialist, I think is the official language, in the ever-changing COVID-related regulations and safety issues. So she is the perfect person to also help us today. So I'm going to turn it over to Nick first. Nick, are you, there we go. Thank you.
I'm unmuted. Yeah, so this is all very brand new. They've reformed the regulations from November of 2020 to keep updated. And what the Standards Board does is they try to promulgate laws that are reasonable and enforceable. And a lot of thought and debate has gone into it, and there's a lot of back and forth. But what we've really come down with is I can't speak. I don't have a PowerPoint or anything like that, but I can speak to our news release and to our frequently asked questions, which cover most of everything anyhow where people have questions. We get dozens of questions every day called into my office and every other consultation office in the state of California. But to start out, I'd just like to say that the requirements from the November 2020 regulation that are still in place, I'm going to go through those really quickly so you know what hasn't changed. And the primary thing is having a written COVID prevention program in place is still going to be there. You still got to have a written program, and you need to provide training to your employees. All the notifications are still in place, so notifications of the local public health authorities and notification of other employees that might have been exposed to COVID. And also the requirements for quarantining and the quarantine and exclusion pay requirements are still in place. So all those basics are still there, but I'll go into the changes, and because this has a lot to do with the vaccination and changing, so things can open up a bit more, and people can work, with more of a degree of certainty and a feeling of safety. So I'm just going to talk about if you have vaccinated employees, this is the changes involved for them. They do not need to be offered testing or excluded from work after close contact. And this was a contentious one. They do not need to wear face coverings except in certain situations where the CTPH requires it. So, fully vaccinated don't need to wear face covering in the office or wherever you are. But the employers must verify and document vaccination status of the fully vaccinated employees if they aren't going to wear face coverings. So that's the big change for people that are vaccinated. For the people that are unvaccinated, they may request respirators for voluntary use from the employer with no cost and no fear of retaliation from the employers. So and just getting right into the respirators, usually people think of the N95s as the respirator of choice. That's usually the way people go. And also a side benefit to having N95s that fit the employees that are available is that COVID's still around, but also if we're living in California, wildfire smoke is still around too. So these are also useful for that as kind of a side note. Also, employees that are not fully vaccinated and they exhibit COVID-19 symptoms, they must be offered testing. So the testing must be still in place for those unvaccinated employees. Ventilation is also a key aspect of prevention of COVID, and outdoors is best. And now they're pulling away the restrictions of making people mask outdoors. unless they're working in really close proximity to each other, and then they're, or unvaccinated people are working in close proximity to each other, and then masking should be encouraged anyhow. And employers should evaluate their ventilation systems. They should do this anyhow, especially with, wildfire smoke and anything, but be evaluated for the right filtration level. The minimum efficiency rating value, I think, is 13. For hospitals, it's higher, it's 14 and above. So employers must maintain their ventilation systems well. And when they're, and so employees are not to be discriminated against either if they decide to wear face coverings, either if they are vaccinated or unvaccinated, doesn't matter, they should be allowed to wear a face covering. And what face coverings do is they provide source control, but employees should be aware that if they really want to protect themselves, they should wear a real respirator, which is a type of face covering, but actually effectively filters out the particles that you would want filtered out. And skipping back.
Nick, may I ask you a quick question? Are
Yes.
N95s acceptable?
Oh, KN95s. Okay, there's a number of, most KN95s are just face masks, and they do not provide you any kind of respiratory protection. I personally have done fit tested with like 18 of them, 18 different brands, and they all failed except for 2, and they were KN95s. The ones that go all the way back behind your head, I would say stay away from the KN95s if unless you're just going to use them as a face covering for source control, and get real N95s, NIOSH approved N95s for the people. I personally, when in the height of the pandemic, I was predicting this pandemic for the past decade. People thought I was nuts, but I have a half-face elastomeric respirator with HEPA cartridges, and I used to wear that whenever I was in an enclosed area with strangers. So you can, but it's up to the employer. N95s, NIOSH approved, should be supplied by the employer in a variety of sizes, and the people should be duly trained and informed that I think it's the CDC or one of those agencies, they recommend if you wear it 5 times, don and doff it 5 times, usually the N95 gets deformed. It gets dirty, it gets wobbly, and then you don't have a good seal around your nose. And where you have the most breakthrough is right here in the nose bridge. So you got to make sure the bridge is sealed up there. And if it's deformed, it's not going to form a good seal, and you're not going to get the protection that you want. So you need to train your employees on how to wear it correctly, and to have enough on hand so they can keep replacing them if that's needed. And also, if wildfires come along this summer, you will have N95s on hand so the employees can be protected for voluntary use. And so this is all voluntary use. If you require your employee to wear an N95 or any kind of respirator, then that you have to send them to a medical surveillance program, and you got to fit test them. And have a respiratory protection program. So this is all about voluntary use. And they talk about citing employers. People are mostly concerned about what is CalOSHA? They're going to come out here and they're going to cite me. Well, I used to work for enforcement for most of my career. I was the enforcement district manager, and I used to negotiate settlements with employers. And when I was an enforcement officer, I used to bust employers. And what it really comes down to, and they say in the documents here, is that if the employer is making a good faith effort, that goes a long way. And so when I used to talk with employers about their citations, if they really showed good faith and that they were trying to do the right thing, that went a long way. And there is employers out there that don't care and they can't be bothered, and that will hurt you in the end. So if you have a good faith and you're trying to be in compliance and you work with an enforcement officer, if one happens to show up at your doorstep, then things will go probably quite smoothly if you really put an effort in. As far as face coverings, like most, what the face masking is done for is for source control, because when you speak, the massive amount of particles it's from talking, singing, coughing. Those are the ones that generate the particles. So that's what the face coverings are mostly for. So if there's a person who's unvaccinated, they can be without a face covering and work, but only when they're alone in a room, or they're eating or drinking, or they have some other accommodation is required, because it does take a draw on the person. They could have a health issue or something to that effect that makes wearing a face covering difficult, or when the job duties of the face covering make it infeasible or create a hazard. But that's a very case by case basis, and you'd have if an enforcement officer comes out, you should have a very good reason of why you're doing what you're doing. And as far as vaccines, I think I already mentioned that you should document that and make sure that, if people are indoors working with each other, not distancing, that you have that documented, that they've been vaccinated. And as far as testing is concerned, I don't know, I'm sure everyone on this Zoom call has got a COVID test at one point or another. And as far as the unvaccinated people, if they're symptomatic, they need to be tested. And if they've been exposed, so if there's a documented exposure, they need to be tested too. And also during any kind of major outbreak, they also need to be tested. Even the vaccinated, though, need to be tested if they develop symptoms after a documented exposure. So, because there has been breakthrough cases where people have been vaccinated and they still get COVID-19. And all employees during a major outbreak need to be tested, vaccinated and unvaccinated. And I think that pretty much covers the changes. Is there any questions that I could answer about the new COVID-19 prevention program regulations?
So I'm going to ask you the questions for other people, Nick. Thank you so much. What if unvaccinated employees do not want to wear a mask while indoors?
I mean, there's the exception for that is that they're alone in a room, and I think the employer should work with them. I mean, physical distancing. Let's see. Yeah, I don't know.
This might be a Melissa question too. I don't know. I know we're got off our timeline a little bit, but let's address that, because I think that is a very real concern. You have the right to ask somebody if they are vaccinated, right? Let's back up. You have the right to do that as an employer. You can ask to see that card. And if they are unvaccinated, what if they refuse to wear a mask?
That is an area that I would be talking about in my program, but in essence, I think what's really important, Nick, is when you said that employers need to show a good faith effort, and everyone who's on this call is trying to do their best. We're all trying to do our best. So probably the slice that I bring to this program is, how do you talk to employees? How do you make this work in a world where people have such varying opinions? And, organizations have to decide where they're going to fall on some of these decisions. So an individual who is not vaccinated, you have to ensure that they are wearing their mask while they're at work. And that is the actual language. I could hear Nick, before he just rushed off, flipping through paperwork, probably the same as me. So, printing out the new ETS standards, but the words are ensure they are worn. So the employer is going to have to make sure that it's worn in locations where an individual is not isolated alone in a room. And that will be challenging. So I will talk about that a little bit more in my part. And Nick, if you want me to pull up the website at all and go to any of the FAQs, I can do that for you on a dime.
Okay, thank you.
I'm wondering, Nick, should we maybe go to Melissa next? We're getting great questions. Keep your questions coming. Maybe we go to Melissa next, and then we come back to more of a dialogue.
I think that's good, because like I talked to a very narrow health and safety aspect of this all, and this whole area crosses all the human resources aspects of from EEOC to labor standards to workers' comp. So that sounds great to me.
Okay, let's do that, and keep your questions coming. We're going to be organizing them, and we'll share the questions with our panelists after Melissa. So Melissa, we'll turn it over to you. Thank you.
Yeah, fantastic. So I am Melissa Irwin. I work with TPO, the HR experts. We're here in Monterey. We've worked with Community Foundation for Monterey County for 20 some odd years. It's been a pleasure. And again, the slant that I want to bring to this is from an HR perspective, from talking with your employees. How can we make that work a little bit better? So at TPO, we are building confident leaders and supporting positive HR outcomes. And I do have a PowerPoint program for you, because that's just, I've started thinking, what are the questions that we're getting? I have 15 minutes and I have 5 areas that I want to go over. One is assessing comfort level, monitoring comments in the workplace, facilitating required time away from work, following California and local requirements, and managing schedule requirements. It is more than just how do you implement the new CalOSHA emergency temporary standards, because my charge was how to have a safe workplace, which encompasses this area of safety is much more broad. And it is around how does an employer ensure that they are operating within these many different areas related to COVID. So with that, the first is assessing your comfort level. Each organization decides their readiness for opening or reopening. And I know that many of you on this call, I recognize your names, you've been open this whole time. You've been working this whole time. Most of us have been working this whole time. So take that terminology and change it to what's appropriate for your organization. But employers are going to decide, will they follow the reopening guidelines or not? There's some risk reward here. The employees and customers might be queried to determine how is it that we're going to put some of these guidelines into practice, knowing that we all have a difference of opinions. And I think the one that's really hitting the most here is just around that we see when we're walking around is wearing of the masks. So on the left-hand side, there's a TPO COVID alert. We've done 54 of them. This is the 54th one that you see on the screen right now. And many of you on the call are TPO clients. You've received this. And the point here is that while we know that employees can, thank you, CalOSHA, can unmask if they are fully vaccinated, the bigger question is, are employers going to allow that? So you all have been going in to get coffee, to go get breakfast or whatever, go to the grocery store. And here's my favorite local grocery store. Theirs is masks required unless vaccinated, fine. And then I did not snap a picture of it, but I went to a bakery just down the street, and it was no, everyone needed to be wearing their face masks. Went to another restaurant and some employees were wearing the face coverings, others were not. So we all have this different sense of what is right for our organization, for our employees, for our culture, and we need to honor that. If you're interested in the alert, you can click through on the handouts. There is a hyperlink to where those are located on our website. The next area that is really important is monitoring comments. So another COVID alert we did was, and I don't expect you to be able to read the words here, but maybe you can catch the red, which is just chit-chatting about COVID, vaccination status, wearing a mask, not wearing a mask. That's just idle chit-chat, right? Yeah, not so much. We're adults. We talk about adult things at work. We have different opinions. This is lovely. However, you really have to make sure that those discussions are not going over into areas of potentially a claim for harassment or discrimination. So if an individual is wearing a mask at work, there's not an assumption about their vaccination status. and really an understanding that comments that go into medical or health of an individual or religious beliefs, that could be potentially a harassment or discrimination complaint. And we want you to stay certainly away from that. So you have to monitor those comments. This has always been true. People talk about their own personal beliefs on many topics in the workplace. The employer needs to monitor that and make sure it doesn't cross over into, at minimum, areas that make people feel, mildly uncomfortable. And then certainly to those areas that are protected by laws that are out there. So number 3 is facilitating required time away from work. So let's talk about, an example is right now, if an employee has COVID symptoms, and you might think, well, we don't hear a lot about this right now. We're hearing a lot about vaccinations, but you all are managing your workforce where you still have people who have what is on the list for COVID symptoms. What are you going to do about that? The same safety protocols are still in play. It is still the same idea that individuals do need to isolate for the 10 days, unless a healthcare provider indicates otherwise, that it's not something that the healthcare provider determines as a concern. And then you have to deal about the pay. So for the California supplemental paid sick leave, if you have 26 or more employees, then that is going to be 2 weeks of the California supplemental paid sick leave. Then there are the 3 days that has always been there since for many years, since 2015, the 3 days of California paid sick leave, that's available. And then CalOSHA is going to talk about exclusion pay. So where an individual needs to be excluded from the workplace because they had a workplace exposure, close contact, less than 6 feet, 15 or more cumulative minutes in a 24-hour period, then that, if you think about it, what they're saying is it's not the employee's fault that they were exposed in the workplace. They were doing their job, and therefore they need to be paid for that. So facilitating this required time away from work. And we certainly hope that this last bullet will very rarely come into play, though we certainly have seen it even here in the Monterey Peninsula. For serious illnesses, there is the 12 weeks of unpaid leave, and that's the CFRA for California, FMLA for federal, 5 or 50 employees, depending on if it's state or federal. And though it requires the employee to have worked 1,250 hours and 12 in the past 12 months and specific healthcare provider certification, it does guarantee a job. So I feel for you, employer. You're trying to manage the safety requirements. You're trying to actually sell your product or do your business, as well as facilitating the time away from work requirements as well. Okay, so number 4 is going to come up, and that's following California and local requirements. So this is where, and each of you who are on this call, I think you are covering this pretty well, or you wouldn't even be on this call. But you really have to stay up to date. And if that means printing out a new packet of the CalOSHA ETS, Emergency Temporary Standards, their fact sheet, their FAQs, the model written program, make sure you stay up to date with that, as well as what's going on with the Center for CDPH in California, which is different than the federal, on the federal level, the CDC. And of course, any local requirements as well. I did notice, Kim, earlier when you posted the link for CalOSHA, it was just for the FAQs.
Yes.
The link that's here will get you to a landing page, and I'll pull that up, I think, later. That will be helpful. And it will also provide the model program as well as fact sheets and other examples. So for this example of, well, what could this mean? This is where an individual would be exposed close contact at work. So we don't get as many of those calls now. At TPO, we're fielding calls every day from clients around what do we do in certain situations. And while we're not seeing as many workplace exposures, they are absolutely still happening, and really making sure you are following the requirements, determining who had that close contact, notifying the employees. It really is spelled out really very detailed in the program. Number 5 is going to be managing schedule requirements. I think we could have a 2-hour program just on this one slide. And what I'm hearing a lot of is, how can we have a safe workplace if we don't have enough employees who are working, or we need people to come back into the workplace. So the first example is an employee doesn't want to come back to work or come back to the office. Remember, we're all different. We have clients who their employees are not back in the physical workplace, and many of them never will be. We have other clients who've been working at the workplace this entire time. People are fearful of some people are fearful of COVID, of coming back into the workplace. How can you, as a manager, supervisor, business owner, alleviate that fear? Provide information is going to be my first recommendation. Share with them what are your safety protocols. Share with them that you do have a plan. There's been a lot of talk about the second bullet, that maybe some people are liking the California ADD unemployment payments. They maybe don't want to come back to work. And I don't know the percentage of that is really going on here, but what can you do about this? If you have a job that you now need filled, you can offer that job. If you've offered the job to an individual, then technically, then unemployment would get information about that, and it might impact their payments. However, EDD is completely upside down right now. I think we all know that. Some individuals don't want to come back to the office because they don't have, or they found out they don't need to have childcare if they're working from home. These are issues. What can you do around that? Well, it's summer, so school has been so impacted by COVID. It's summer, and it kind of goes back to, what did we do 2 summers ago? What was the plan 2 summers ago for childcare even? And then there are some people who just like working from home better. And yeah, there's a lot of that. So from my slice of this, how do you help employees feel like they are being listened to about what they're interested in, while at the same time managing your business, making your business decisions, knowing that if you decide, no, we need to call people back to the office, that's where the synergy is, that's where the communications is, then there will be risk reward to that. Or some organizations might be lagging a bit longer and saying, no, we're okay with this new model. Everyone is different. Then we have the scheduling requirements. Was, what if an employee doesn't show up for work? And I was passed along a little sign that said on the outside of a business, thank you for being kind to the employees who chose to show up to work today. We're really trying hard to make this all happen. And, you have to first determine, why aren't they showing up for work? Is this something that has protected time off associated with it? Are they requesting, don't forget about all those other leaves. Is it something that might be a pregnancy disability leave, or an individual had a workers' comp claim, or it's regular sick leave, or certainly related to any of the COVID reasons as well? And then absent that, you continue on with your usual corrective action up to and including termination of employment, should you need to. Though you've got to really look at how far are you going to push something. So an idle threat of coaching, counseling, disciplinary action, when you know you don't have enough staff to fill your positions, might put you in kind of a different position. So that is number 5. And what I want to say is, keep up the good work. It's been challenging. Don't stop now. Don't let your practices fade out now. And the players here, you have safety, workers' comp, insurance, EDD, payroll, IRS, if you're looking at tax credits, and all of the agencies that are involved. So The last two slides here are critical COVID resources, where the handouts that Kim will be or has, I can't watch and talk at the same time, of the handouts, these are hyperlinks to the actual locations. So CalOSHA is great, California Department of Public Health, California Supplemental Paid Sick Leave, again, if you have 26 or more employees, the Federal Center for Disease Controls, the Federal OSHA, California Unemployment, California Labor Commissioner. Labor Commissioner is where people go to file concerns about breaks, meals, overtime, all of those issues that are still at play even during these times of COVID. IRS, then California industry guidance, and then TPO's landing for our COVID alerts. If that's something you're interested in, you can pop me an email and I can sign you up for those if you haven't been receiving them. So that was my 15 minutes of talking about kind of COVID protocols, practical HR tips. I know that was not tied 100% to just the new CalOSHA requirements. My charge was to pull that out to just general areas of safety and kind of COVID regulations that are in the workplace. Okay, so with that,
thank you, Melissa.
Yes.
Really appreciate all of that information. So I think we have your questions categorized into the big buckets of masks, certifying vaccination status, HIPAA and discrimination questions, quarantine and outbreak. I think they're the big buckets. So that's what we'll start with, and we'll make sure that we include anyone's, if there's somebody else that we didn't get, we'll make sure to incorporate that. So Nick and Melissa, as you know, there's a lot of talk about what if you're unvaccinated. Let's start at certifying vaccination status. That makes more sense. Okay. So we know we can self-certify let's back up. Does an employee need to show you the card, or now the actual, I got a little QR code the other day from the state verifying my status. So do they need to show it to you, or can they just
self-attest?
Self-attest.
I'm not sure.
Okay, we'll find that out.
The employer has three options. They can either allow an employee to self-attest, and that's one option. The other option is the employer chooses to show proof, to document and look at the card and to check yes or no that the individual provided that proof, if you will. That's option 2. And then option 3 is to not deal with the vaccination status at all. And that one would require everyone to keep their masks on because they'd be all treated as unvaccinated. So those are the 3 choices that employers have, and there's risk reward to each one. And each choice is going to be appropriate for each different kind of an organization. We do not recommend, nor do the resources that we're not attorneys at TPO, we are HR consultants. The attorneys who I have heard as well do not recommend you photocopy that vaccination card.
Great, yes. So to that end, so it's confusing in a workplace when certain people wear masks and others don't. Is an employer allowed to reveal the vaccination status of another employee? No, we got to know. Okay, so no.
This record must be kept confidential. So whatever the employer does to either self-attest or getting proof of vaccination status, they must keep that confidential so other employees don't know.
Right.
Yeah, what I hear, and I see one of the comments mentions HIPAA, and we hear that a lot of, oh, it's a violation of HIPAA rights. It's actually not HIPAA unless you're in a healthcare setting where that medical information is shared. But it certainly is a privacy issue, and it's also just a what's right and okay to talk about in the workplace. So people are going to talk. They have been talking about oh, I just came back from my vaccination. Do you have symptoms? Do you not have symptoms? That is certainly happening. Again, we just really need to make sure that there are parameters around what's appropriate and not appropriate at work, and to not make assumptions. So if an individual is wearing a mask, you don't assume that they are not vaccinated. There are plenty of reasons people choose to wear a mask, even if they are vaccinated. And so get those assumptions out of that.
Okay. And along with HIPAA, there's a question about where can they find that law that allows, and I think I know, but I would love one of you two to share it. You know, that you know, there are lots of people out there, as you mentioned, that believe that it's a HIPAA violation for an employer to ask for verification. But there is some place that employers can go that shows where they are allowed to. It's EEOC, right?
Yeah, from what I've heard.
Okay, and I'll share that with everyone in the resources as well.
Well, you really are finding it in these multi-agencies that overlap with one another. So EEOC is federal, which is lovely on a federal sense. California, we sometimes go our own road in California, but California, the Department of Fair Employment and Housing, also very clearly has said you can ask vaccination status. Well, let's back up. What's going on here? Usually medical information is private, and it still is in the workplace. What has been decided is that COVID is not usual. This is not our usual flu, our usual stuff. So there have been carve-outs, and you can absolutely determine, ask for vaccination status from both federal, state, that employ the ETS, the CalOSHA ETS says that you can ask for that vaccination status. Now, people have the right to not provide it. That's fine. So if an employer asks an employee to fill out either a self-attestation or where the employer is checking it, a form, the employee can say, I don't want to do that. The appropriate response to that, in my mind, would be no problem. We're not going to take your hand and force you to sign this document. No problem. But if you choose not to, we will consider you to be unvaccinated, and therefore you'll need to wear a mask in the workplace. And there's another component that's so important, and that is if there is a exposure in the workplace, that if you're vaccinated, fully vaccinated, then you don't have to quarantine after that exposure. So those two pieces of information, an employee knowing, okay, if I don't share my vaccination status, I will be treated as unvaccinated, can cause them to change their mind. And that's what I am really focusing on, providing information to employees so that they can make their own decision. What I don't want you to do is to get into an argument with employees about what law says what. I don't want you sending them the links to all the government agencies trying to say whether it is allowed or not allowed. It really is just, we are managing our requirements as well as employee preferences. If any employee chooses not to provide the information, not a problem. We'll consider it unvaccinated. And I think there's another piece. You're not going to get grief about it. We're not going to let people shame you or query you in the workplace.
Great, thank you. And then suppose, so you've been clear, if somebody refuses to share, to self-attest or to show you their card, they wear a mask. That's a policy to implement. So what if somebody lies? I think there's all this discrimination, and I almost feel like maybe we have webinar number 2 with an attorney that's working in this. Any thoughts on that?
I can't really.
You're always going to have liars, cheaters. It's just going to happen. So it doesn't matter. You follow your protocol. You do what you are supposed to do. So for some people, some employers might choose to actually see the card because they think that more clearly shows the true vaccination status, because there are no false cards out there anywhere, right? Sarcasm, enter sarcasm there. So the employer, you just do the best you can do reasonably, whatever makes sense for your organization reasonably. There's another player in this game that I think is really important, and that is your workers' comp carrier. Your workers' comp carrier definitely has an interest in the safety of the workplace and potential workplace illnesses and injuries. So you may want to check with your workers' comp carrier or broker and see, what are they recommending? Maybe they prefer or are requiring for your plan that you are checking documents. That's one area all of you on this call, you might want to check back with your workers' comp carrier.
Yeah, good, thank you. Okay, so now we've talked about vaccination status. Hold on, should self-attesting being writing or email? Either one works, right? Something in writing and email.
I think you're looking at how will you be able to access that information. If you have 10 employees versus 1,000 employees, your administrative process around that is going to change. The point is you want to just keep it confidential like you would with any kind of medical information, or as much as you would like the I-9 documents, that you're going to make sure that people respect that privacy.
Great, thank you. Okay, so let's move now to masks. So we talked a little bit about what do you do if an unvaccinated person refuses to wear a mask? What a quandary. Any comments on that?
I mean, I think the employer could work with them, and either put up barriers or more isolation, where they're, that's a tough quandary. But I think they could work with the employee in some way to make exposure less, and try to fulfill it through one of the other requirements.
Mm-hmm. Yeah.
Part of this is when you're looking at an individual, you have employees request things all the time, working a different shift, having a different chair, whatever it might be. And so if an individual were to say, I don't want to wear a mask, there's a difference between I don't want to and I can't. So you have an individual who might have a preference to not wear a mask, and you might choose to modify their workplace for that reason. That's different than an individual who says, I can't wear a mask. I have a medical condition, and my doctor has said that I cannot wear the mask. That's different. That's actually a potential reasonable accommodation where, and quotations, reasonable accommodation, where the employer is required through an interactive process, meaning you ask questions, you listen, you get healthcare provider documentation. That is key in order to determine if you can make that accommodation. Sometimes the accommodation can be made. What is an accommodation? Putting them in a different location. Maybe they get, they're isolated in their own room. That's not going to work for every employer. Maybe they work from home. It's not going to work for every position. So the idea of reasonable accommodation is where it's driven by a healthcare matter, then there is specific documentation. And that's something at TPO we do spend a lot of time with clients on, where the DFEH, Department of Fair Employment and Housing, has a great form that starts that accommodation process, where you're listening to what the employee is asking and determining, is this just a regular workplace request, like I would like, an espresso machine in my office, or is this something that is tied to a healthcare provider requested accommodation?
Great, thank you. So this is just a basic question that is just a reminder. If now in the workplace, especially for those that weren't on initially, if there are anybody that's vaccinated, except for special circumstances, gets to go free of their face mask, right? And then if you're unvaccinated, you have to wear a face mask.
Indoors, yes.
Indoors, right. And then there are some special circumstances, like in healthcare, and we'll send all of that out later. There are particular circumstances. Do you want to mention them really quick, Nick, or do you know
special circumstances?
Yeah, healthcare.
I don't have them handy right
Okay,
now.
sorry to set you up like that. I will.
But I think this is important. There may be people on the call this relates to, each industry is different. So healthcare, the aerosol, if you're under the aerosol transmission, you're going to know about that if you're in healthcare, patient providing. But then there are also some exceptions for if it's a shelter, a homeless shelter, or schools, including childcare. And so it's important to know your industry and where those carve outs might be as well.
So we talked about wearing masks indoors. So can you discuss how this affects outdoor staff? Mask wearing.
It shouldn't, the mask wearing should go away generally, unless people are working in really close proximity to each other, because when we talk about sharing COVID particles, it's usually from people talking or coughing or whatever in close proximity, and that can happen outdoors. The outdoors is the best ventilation possible. Dilution is the solution to COVID pollution. So, but still, if they're working, like say on a construction site, they could be two construction workers could be working on something in close proximity, and in that case, they might be necessary for them to be masked up. So because they're talking to each other and they're in close proximity. But generally outdoor work where they're spaced enough, it should be fine. No face coverings. Okay,
great. Now there's some folks that aren't supposed to get vaccinated. I know they have low immune systems, they have religious beliefs. Well, that's a choice. So the employer can still ask them for their vaccination status, right? That doesn't, just because you might have an exemption, you can still be asked no matter what the exemption is. Is that correct?
You can be asked. What you don't want to do is follow it up with why. So that's why a form is kind of nice, that it only has certain check boxes that if you're the people on this call, it's so diverse. We have ag, we have people who work, out in landscaping and such. So, depending on your positions, if you have it where you can do a form that's an electronic form and they only can check yes, no, and then e-sign it, was really the preference, because then people aren't writing in the reason why. And we don't want to know the reason they're not vaccinated. It does not matter. It doesn't matter if you can't get it or if you are, if that's your personal preference. We don't want to follow up with the why. It's just, if you're not vaccinated, then here are the rules. Now, if the employee says, I'd like to ask for an accommodation, then that goes into the discussion about reasonable accommodation.
Right. Okay. And then for outdoor employees, you still want to ask them about their vaccination status. Is that correct? You'd ask everyone. Is it? So if you've got folks that only work outdoors, would you still ask them for their vaccination status?
Nothing explicitly says in the release. It talks about facial coverings outdoors. It doesn't talk about outdoor staff and vaccination status. I would think that it would be across the board. You just ask, because outdoor people are going to come indoors. Right. So
that's right. And they also, outdoor people also often, from my experience with clients, they travel in vehicles with their coworkers as well. So it is across the board, remember, again, the reason is that people who are vaccinated, they won't have to quarantine if there's a positive in the workplace where there was close contact, as well as the masking issue. So it's not just the masking issue that's relevant here. The employer needs to know in order to correctly work through any potential workplace exposures.
Great, thank you. So we still have a mask questions. Nick, can you talk more about the N95 masks and why all brands don't work? This person has purchased some that said FDA approved. I guess it's a KN95.
Yeah, FDA approved is not NIOSH approved. NIOSH is the National Institute of Occupational Safety and Health, and they are the ones that do the standard for the respirators. See, respirators are a type of mask. Now, out there right now, we have all sorts of facial coverings that are not meant to protect.
Oops, lost him. Oh, there he is. Okay, lost you for a moment, but you're back.
You said we lost you. You said not meant to protect, and we lost you right then.
Oh, okay. They're not meant to protect you from other people. It's only meant to prevent you from your big particles from getting to other people. So it's source control. That's what masks are generally. But if you have respirators, like, and everyone knows the N95, which has the straps that go all the way around the head, around the thing, and that's what the medical care people wear all the time. Most people are familiar with that, but then there's the KN95s, which came about. I mean, I remember when I was first like, what about KN95s? And I was like, I've never heard of that. What's a KN95? I had no idea. I had to like look it up on the internet. And then I figured out, but basically they're like they just take the name N95, but they just put a K on the front of it, and they're not respirators. There are a couple of them that qualify as respirators, and they're NIOSH approved. And the ones that are not NIOSH approved don't do anything. The ones that with the ear hooks, they do not give you a seal on your face. Anything with ear hooks is not going to give you a good seal as a respirator. It will work as a source control, and traditional N95 will have the polyethylene blown melts, polymer that's charged that will attract any kind of particles and filter them out before they get into your breathing zone. And those go around the head, and they're very tight fitting, and they usually have a metal thing here to make sure that you're not pulling in a lot of air through your nose bridge. So it's all getting filtered.
And I think there's maybe a little bit of a clarification here. Employers are required to provide masks, but you're only required to provide a respirator if the employee asks for it. So that is a little bit of a difference. So we get the question of, oh, we have to stockpile all N95s or equivalent respirators. And really, you've had to already provide the masks in the workplace for your employees at no cost to the employee. This new provision about the respirators is for employees who request it. So that is kind of a setup, Kim, to one of the questions here that says, what about the shortages of N95s?
There isn't a shortage of N95s now, just so everyone knows. Okay. There's no excuse to not have N95s. There's warehouses full of them, and unfortunately, people have a short attention span. They're like, oh, it's all over, and they're not buying N95s, not thinking that it might come back, or you might even need them for wildfire smoke that will be wafting all around, likely soon. So yeah, and this is I'm actually really happy about this step up in requiring respirators, N95s, for unvaccinated people that request them, because I think respirators are the way to go. They actually protect the person and not just use it as source control, because people have the big worry for me as an industrial hygienist is people wear masks and they think they're being protected, and they're not, because it just flows right in, and so they feel comfortable in maybe crowded areas or being exposed to someone who has COVID-19, and they have a false sense of security. So I'm a big fan of this requirement to have respirators, HEPA, high efficiency particulate air respirators available, N95s, or even half-face elastomerics, which I'm even a bigger fan of.
Thank you. I am so reading these questions. I'm just so appreciative of you two being with us and responding. There's so many questions that businesses have. So, in terms of N95s, you can get them. I just looked, I could get them by Thursday from Amazon if needed. So they're available. And then where do we recommend purchasing proper masks that will protect us? And I think any place you can find it. I did notice personally that like Home Depot used to have N95s and then they seem to take masks away. But you can go onto Amazon, not a promotion for Amazon, but they're available.
Right. There's like industrial supply warehouses online that have every variety of respirator. Just make sure it's NIOSH approved. That is what's crucial.
And we have so many supply places around here, whether you go to Hayward Lumber or, you know, our local vendors as well. Nick, can I ask a question? I had a client who their employee was having some challenges because of all the cleaning that was being done in the workplace. And the question, you seem so mask knowledgeable. The question was, are there masks that can help to not smell the smells of the cleaning? You know, we're trying to solve one problem and we create another problem.
That's the problem with the cleaning products, is that they are also they're lung irritants, and some people are more sensitive than others, and it can cause major health problems from these disinfectant agents. So there are respirators. N95s only filter out particulate, you know, the particles, like whether it be COVID particles or smoke particles or asbestos particles. If you want to have organic cartridge respirator, you're going to have to get like, they might have disposable ones, but I don't think so. But just the elastomeric ones with the canisters on them, right. You can get that. I can't imagine wearing that in an office all day, and, you know, a half-face elastomeric with organic vapor cartridges, because they have, in these cartridges, they have carbon, which attracts the organic vapor, and so it doesn't go into your lungs.
That's helpful. Thank you. My recommendation was for them to talk also with their workers' comp carrier in order to possibly get some information. But that's helpful. Thank you.
And I think getting to the source, it's like the substitution is the way to go. I mean, if you have like this really odorous and disinfectant that's affecting people, you maybe should go with a more non-toxic one.
Yeah. Absolutely. Maybe it's too concentrated.
Exactly.
So we'll do 2 more questions on masks and then let's move on, because there are other topics that people want to cover. And one is, to safely remove masks indoors, what percentage of the workforce do you need to know your vaccination status to make the decision? The regulation is challenging in this way. It's not percentage. It's, if you're vaccinated, you don't have to wear a mask. If you're not vaccinated or choose not to reveal your status, you need to wear a mask, right? Yes. So it's not a percentage.
I think that I just feel for people, because what that question tells me is that somebody who was really asking a question from the proposed CalOSHA requirements that then were changed. So it's so difficult to stay on top of it. There was a time where we thought that everyone in the room had to be vaccinated in order for any mask to come off in the room, but that's been removed, with just as long as it's just individual based now. It is not group based.
Right.
So if you blink too long, you miss what's new out there.
A lot has happened in the past year.
Yes. So then another question is, why not make it mandatory for unvaccinated employees to wear respirators? If it offers
voluntary, okay. And if you make it, okay, so you can do that, but if you make them wear a respirator, you're going to have a respiratory protection program, and you're going to have to do medical surveillance. So you're going to have to send them in for a medical test with a spirometric exam and a B reader lung, X-ray. And then you're going to have to do fit testing, either quantitative or qualitative fit testing, to make sure the fit's right, so no particles are getting through. So once you make it mandatory, a lot of paperwork kicks in, and I am sure most employers are not up to the task.
Yeah, I got scared just listening.
But thanks for reiterating that, Nick, because I think people believe they can just run down to the local supply store and get a stock of the N95s and they're good. So what you have said now a couple of times is that to use the respirator, there is training that is involved. And the spirit behind that is that you are getting a seal. It is correctly being used rather than, just kind of kitty corner off of your nose and your chin, so that you can get air flowing in there. That would defeat the purpose of it.
So we'll move on a little bit, keep on putting your questions in. And this is around discrimination and, really digging in a little bit deeper. And you may not know these, and that is fine. If an employee refuses to return to the workplace due to not being vaccinated and is then terminated, is that a form of discrimination? So they said they didn't want to come to, I guess they didn't want to come on site, is my guess what that means. And you terminate them because they don't. So I'm going to reinterpret this, and whoever posted this, let me know if I got it right or wrong. So I'm an employee. I do not feel comfortable coming into ABC company because of COVID. I'm still working at home. Can you require me to come to work or terminate me? Yes. Okay.
Yes, but before you would terminate someone, there's a lot that goes on before the termination part of it. So employers can require employees to come back to the workplace, even if the employee thinks they can do their job, and maybe they do just as well at home. The employer can say, no, your job is here, you need to be here. And if an individual chooses not to, then the employer would then have to decide, how far are we going to play our hand on that? Would we consider that to be a separation of employment? If the individual said, I don't want to come back to work because I'm not vaccinated, then to me, the areas to talk about are, well, you still need to come back to work, even if you're not vaccinated. And when you're here at work, here's all the safety protocol that we are following. And you will wear a mask. Anyone else who's not vaccinated wears a mask. If the individual said, yep, nope, I still don't want to come back, then separation of employment certainly could be an option. You have to always be aware that there's nothing that would stop an employee from saying, oh, I think the reason you terminated me was because I don't want to get vaccinated. That's always a possibility, but the employer's response would be, no, it's because we had a job for you to do that you were not accepting. And we had, safety protocols in place. We already flushed out if there were any accommodation issues. So really, Kim, the answer to those questions are always, it depends. There's always a little bit more into that. But, I really want to start with where employees are concerned about coming to work is education and helping them understand what the protocols are. Okay, I have to say this. I always in a training say, it's kind of like driving on the highway sometimes. We know the speed limit, but we decide how fast or slow we want to go. I know that we have employers out there who don't have their safety protocol up to standard, who aren't monitoring the individuals who are unvaccinated with their mask use. They might not care. In that situation, if there's an employee who's not wanting to come back because they know the employer is not following the correct protocol, that is where I would say there is a huge pause, and the organization needs to consider their risk reward, how fast they're driving on the highway. Are you going through Fort Ord area or not? Because you then have opened up these other risks. You've opened up the potential of a retaliation claim for reporting unsafe work practices. And that is just a reality where each employer is doing their own thing. I am hopeful that those of you who are still on this call, you care enough about this topic that you are trying your good faith effort, as Nick said earlier, to comply with the ever-changing regulations.
Right. Thank you. Okay, so let's go to a few questions about if employees are sick, quarantine, and outbreak. Okay, so are employers still required to self-certify COVID symptoms? I'm sorry. So before it was check in every day, let us know how you're feeling. Is that still a requirement?
Yeah, from what I understand, and I haven't looked at the fully reformed regulations, but it wasn't the previous one, and I'm assuming it's going to be the same for this one too.
Okay.
Want to
Yeah.
keep tabs on people's health status, and if they are exhibiting symptoms, to be sent home and to self-quarantine.
Okay. And we'll follow up with folks on some of these questions too, because we know the regulations aren't fully formed yet.
Well, and I think that, employers decide how much they want to do this. So some employers might have a blanket statement of, think back a year ago, we had signs with all the symptoms. We put out messaging to employees saying, if you have symptoms, to go back to your car and call us from there and go home. Other employers chose to have employees complete actual forms, or even to do a temperature check, or even to be tested for COVID. So employers chose how much they wanted to do. So at minimum, it's letting everyone know that if they have symptoms, to self-isolate and to then take the next step as far as what does that mean for the amount of time away from work and how to pay it.
Mm-hmm. Good, thank you. And then suppose someone does get sick. What is the required quarantine time for non-vaccinated employees who have symptoms?
I'd have to look it up again, but I think it's 10. It's very, because it's like when your just test positive and how many days from the test, and or
Right.
when the symptoms. I'd have to have the regulation in front of me with what I usually do is I take the regulation and I get a highlighter out and I read it with a highlighter, because it got, it's a long and it's very detailed regulation. So I would say read it when it comes out.
I think what I'd add to that is, first of all, I am the highlighter method as well. That is an example. But the question was a difference between vaccinated or unvaccinated, and there is no difference between vaccinated and unvaccinated. If you have symptoms, then you're out of the workplace. And we get it. This is really tough. Is it seasonal allergies? Is it a cold? Is it strep throat? Is it mono? Is it COVID? That's not our role to decide as a business owner, manager. That's not our role. We have to stay kind of in our lanes here, and the employer is required to follow with a good faith effort. So if an individual has told you they have symptoms, or you are aware they are exhibiting symptoms, then you pull them out, regardless of vaccination status. And I believe we know that because elsewhere in CalOSHA, when it talks about if there's a workplace exposure, that those who are fully vaccinated do not have to quarantine, if they are fully vaccinated. So symptomatic individual, regardless of vaccination status, is isolated from the workplace. And I've certainly seen many healthcare providers who then have provided documents that have said, no, this individual is cleared to go back to work earlier than the 10 or recommended 14, but it seems like 10 is what the minimum requirement is, so that you got to check all the time. Literally, I was on it yesterday preparing for this, and CDC says recommend 14, check your local. California says 10, but we recommend 14. So that it is tough. So Nick, I am with you on that, sometimes being uncertain because it has changed. And I would like to go back then to, it's about a good faith effort. We're trying to do the right thing here. We really are. And we're still trying to run a business.
Yeah, it's really hard. So can an employer ask for for proof of their test afterwards? So they're sick, they quarantined, they took a test. Can an employer ask for proof of the test?
The test doesn't let them come back earlier. So if they get a negative test prior to the 10 or 14 days, doesn't allow them to come back earlier. But the question of, can you ask for the result of the test? Yes. Where is there a caution? You don't want anything that reveals more information. Some they're better now, but at first we would get documents that would show the individual's social security number and their other underlying medical conditions. It was just like a printout. And no, we don't want to know that. And the questions right now, at least from our clients, aren't so much around the testings. It's not so much around symptoms, exposures, and testing. It is mostly around vaccination and what's going on. But this isn't over, and we still have to remember how to deal with our exposures, our symptoms, and our positives.
So, God forbid, what happens if a major outbreak occurs in a clinic or a workplace? Are all employees needed to be tested and isolated? Does the clinic close? So this person asked related to a clinic, but this could be in any workplace.
Well, according to the FAQs, it says for a major outbreak, all employees must be tested.
All employees must be tested. Okay.
So,
and that's great. You know, when you look at what when the resources available to you, if you go to the FAQs, you know, under outbreaks, there's a whole section about outbreaks, and it talks about, you know, is it just a regular outbreak, or is it, you know, a major outbreak? There are different definitions for the two. It really is a very helpful tool to work your way through that.
Thank you. So this is a confusing question. Do we still need to have all COVID protocol postings in our windows and our doors? Do we post instructions to visitors? I say it is confusing because I know our county has required some guidance, and then CalOSHA requires guidance. I think there are a lot of different entities that are not quite, haven't been quite unified, and then are not quite up to date yet. Do you want to speak to what you know on postings?
I know I've posted in my own office, so no, but I don't know right now is exactly what kind of postings are required where.
It's a really good question. My family thinks it's interesting that I take photos of signs in buildings before we go into them, because I find it interesting. We, as a business, you are deciding, you need to know what your minimum requirement is, but then you're also deciding, what do you do beyond that? Do you have extra signage or not? And it seems to be all over the board. What I don't know the answer to is what is currently required for Monterey County. You know, remember, you have federal, you have state, you have your county, and that certainly can be confusing. So I know that I'm certainly seeing a lot of those signs come down, or they are reduced. I walked into my own office building today, and where it said masks required, I was really tempted to take a Sharpie and say, unless fully vaccinated. So, you know, I think there's an element to this that is about, depending on your location, employee relations, client relations, customer relations. Are you wanting to be neutral on this? Are you wanting to do just the bare minimum? Or are you feeling like you want to have more information? And then there is, of course, the safety side that hits along to the workers' comp as well.
Right. Yeah.
My recommendation would be to still provide the signage that is aimed at informing people that you are following protocol, and it informs people so they know what to do before they cross your threshold. Is it a masks required for everyone? Is it only if they're fully vaccinated? You know, I did pause before going into a coffee shop this weekend that had zero signage, and it was like, okay, what's the deal? You know, so let's try to make it a little bit easier for the people who are walking into the buildings.
And I'm going to share something as part of the COVID collaborative. We put together a website, MontereyCountyVaccines.com, that has become to include more than just vaccines. And there are signs that we put together that you can download if you want. If you just want basic signs that are compliant with the law, with CalOSHA right now, you can use these. I'm going to really quickly show what else is on this. There's lots of other resources on this website, and because there are still people that need vaccines, we have all of the clinics that we know about, which are usually around 83 opportunities to get vaccinated in this county every week. So if you know of employers that have employees that want to get vaccinated, you can go to this resource. Also, I'm going to talk briefly about vaccines. If you have a group of people, whether they are in your church, whether they are in your place of employment or neighbors, and you can get 20 people together, and at this point, I'm even willing to say 10, we could find someone to come out and vaccinate that group. So reach out to me. You all have my email address, so know that that's available. Another resource that we have now, and hopefully we'll have through the end of the year, is if your workplace wants to get involved in testing, we are involved with the California Department of Public Health. They provide us with free Binax antigen tests that you can use for employees. We can get you trained up. We also have the access to PCR test too. So again, reach out to me if you're interested in either of those. So on that note, do we have any other questions or any, oh, here, what do you recommend for kids? Is a 2/3 layer mask keeping them safe from an adult or other kids? I also use KN95 5-layer for my daughter. Nick, that might be your.
The masking's not going to protect your kids. You know, you need a proper respirator if you want any kind of a semblance of protection. You know, in the way they manufacture N95s, they use a special, you know, polymer fabric, which is, you know, it's electrically charged, and it has a special quality where it lets a lot of air flow through, but it catches all the particles. And when you are putting, you know, people in, you know, layered masks, you make it difficult for them to breathe through. And so if you're going to have like the best fabric that will catch the most particles is like a flannel pillowcase kind of thing. And that's like, that would be the equivalent of like an N40, you know, only 40% effective. And it's super difficult to breathe through. So, yeah. Masks are not PPE, you know, they are source control. So if you want to protect your child, you know, and I got my son years ago, because, you know, and I got him a half-face elastomeric with HEPA. It's too big. I got him an extra small. It's still too small for him, and it wouldn't provide him respiratory protection, even if, you know, he had to wear it. But I was paranoid, and so I bought him a half-face elastomeric with HEPA. So, but yeah, the layering is not. It's where it comes through. It comes through under the chin. It comes through the thing, and you're not protecting your kid, and it's, you know, probably going to make it much more difficult for them to breathe properly.
Great. So we have 2 minutes left. I want to first thank everyone for participating today. I do have one difficult question left, and I'm just going to ask it and see if we can do it in a minute. If an employee who is not vaccinated comes to work, refuses to wear a mask, and then ends up contracting COVID, can they then turn around and sue the company for not enforcing non-vaccinated workers wearing? For somebody that's not willing to take self-responsibility, is there a lawsuit there?
They can always file it. What the response would be, we had a policy. We had our COVID safety policy that we gave to everyone. This is where, if you can show, we had the form that we had people complete, and the individual chose not to complete it. If you can show that where the employer knew that the individual was not vaccinated, and were held responsible for that. So they were coached, counseled, disciplined for not wearing their mask or wearing it correctly. That all would stack up on the employer side of showing that the employer did everything they were supposed to do, and that therefore it would certainly help to deny a workers' comp claim if that were to come to play. And that's why employers decide, where are you going to fall on this? Are you going to keep the record keeping so you have that proof, or not? And that's really an individual decision. But why we would recommend, yes, get that vaccination status.
Yeah, documentation will save you in the end.
We can hope.
Yeah.
We can
Hope.
hope. Then I do see, Kim, above it, are we safe to discipline an employee if they lie on the self-certification?
Oops.
You know, how are you going to know if they lied? My answer to that is, how do you treat any employment situation where an employee falsifies an employment document, whether it's an application or whatever it is? So I would certainly make sure you actually what's your reason for thinking it was false? How do you know that information? But if they told you that, for example, yeah, you would treat, but you're going to treat everyone the same, not just the employees you don't like. You treat everyone the same.
Basic practices.
Yep.
So it's 11:31, and I want to say thank you again. Thank you, Nick. Thank you, Melissa. You have been a blessing. I really appreciate your time. And this is still a very confusing.
Oh, we lost you.
So I will jump in.
Okay.
Melissa, Nick, thank you. Thanks to everyone who dialed in. We may want to reprise this as maybe, who knows, a month from now, as things continue to evolve. We're all trying to figure it out. And Nick and Melissa, you were very, very helpful. So take care, everyone. Be safe. And don't hesitate to check back in with us. It was a real pleasure. Bye-bye.
Thanks, Dan. I appreciate it.
Take care,
Certainly,
everyone.
Melissa. Thank you, Nick.
Take care.
Bye, everyone.
Bye now.